makes us harder, better, faster, stronger.
That don't kill me, can only make me stronger.
Examining the motor system, motor ability. A thorough examination of the motor system includes an assessment of muscle size and tone, as well as strength, coordination, and balance. The patient is instructed to walk across the room, if possible, while the examiner observes posture and gait.
Can I have you walk across the room? Good job.
The muscles are inspected and palpated if necessary for their size and symmetry. Any evidence of atrophy or involuntary movement such as tremors and tics is noted. Muscle tone, the tension present in a muscle at rest, is evaluated by palpating various muscle groups at rest and during passive movement. Resistance to these movements is assessed and documented. Abnormalities in tone included spasticity, which is increased muscle tone, rigidity, which is resistance to passive stretch, and plasticity.
Muscle strength. Assessing the patient's ability to flex or extend the extremities against resistance tests muscle strength. Evaluation for muscle strength compares the sides of the body to each other. For example, the right upper extremity is compared to the left upper extremity. Subtle differences in strength may be evaluated by testing for drift. For example, both arms are out in front of the patient with palms up. Drift is seen as pronation of the palm, indicating a subtle weakness that may not have been detected on the resistance examination.
Clinicians use a 5-point scale to rate muscle strength. The 5 indicates full power of contraction against gravity and resistance, or normal muscle strength. 4 indicates fair but not full strength against gravity and a moderate amount of resistance, or slight weakness. 3 indicates just sufficient strength to overcome the force of gravity or moderate weakness. 2 indicates the ability to move but not to overcome the force of gravity or severe weakness. And 1 indicates minimal contractile power. Weak muscle contraction can be palpated but no movement is noted, or very severe weakness, and 0 indicates no movement.
Balance and coordination. Cerebellar and basal ganglia influence on the motor system is reflected in balance, control, and coordination. First, the patient is instructed to pat his or her thigh as fast as possible with each hand separately. Then, the patient is instructed to alternately pronate and supinate the hand as rapidly as possible. The patient is asked to touch each of the fingers with the thumb in a consecutive motion. Speed, symmetry, and degree of difficulty are noted. Point-to-point testing is accomplished by having the patient touch the examiner's extended finger and then his or her own nose. This is repeated several times.
Coordination in the lower extremities is tested by having the patient run the heel down the anterior surface of the tibia of the other leg. Each leg is tested in turn. Ataxia is and coordination of involuntary muscle action, particularly of the muscle groups used in activities such as walking or reaching for objects. Tremors noted at rest during movement suggest problem in the anatomic areas responsible for balance and coordination.
The Romberg test is a screening test for balance that can be done with the patient seated or standing. The patient can be seated or stand with feet together and arms at the side. First with eyes open and then with both eyes closed for 20 seconds.
A few moments later.
The examiner stands close to support the standing patient if he or she begins to fall. Slight swaying is normal, but a loss of balance is abnormal and is considered a positive Romberg test. Additional cerebellar tests for balance in the ambulatory patient include hopping in place, alternating knee bends, and heel-to-toe walking, both forward and backwards.
The sensory system is even more complex than the motor system because sensory modalities are more widespread throughout the central and peripheral nervous systems. Tactile sensation is assessed by lightly touching a cotton wisp or fingertip to corresponding areas on each side of the body. Determining the patient's sensitivity to a sharp object can assess superficial pain perception. The patient is asked to differentiate between the sharp and dull. Both the sharp and dull sides of the object are applied with equal intensity at all times, and the two sides are compared. Vibration may be evaluated through the use of a low-frequency tuning fork. The handle of the vibrating fork is placed against a bony prominence, and the patient is asked if he or she feels a sensation and is instructed to signal the examiner when the sensation ceases. As with all measurements of sensation, a side-to-side comparison is made. Position sense or proprioception may be determined by asking the patient to close both eyes and indicate as the great toe or index finger is alternately moved up and down in which direction movement has taken place. Integration of sensation in the brain is evaluated by testing two-point discrimination. If touched simultaneously on opposite sides of the body, the patient should normally report being touched in two places. Another test of higher cortical sensory ability is tactile identification. The patient is instructed to close both eyes and identify an object that is placed in one hand by the examiner. Agnosia is the general loss of ability to recognize objects through a particular sensory system. Decreased or absent sensations occur with problems anywhere along the sensory pathway.
Don't forget to exercise, it will improve your quality of life. You need both of these to survive. You're the worth